Okay, hello and welcome everyone. In this video, I'm going to talk about some of the key details pertaining to the US system of Medicare. So I'll start off with some figures from the Henderson text referencing total government spending on healthcare. So overall, total government spending on healthcare at the local, state, federal levels in 2014 was about $1.5 trillion. Medicare and Medicaid alone being at 1.1 trillion. And then Henderson's comment is that that makes this the largest health insurance program in the US. What I'd like to do is place these numbers in context a little bit. So I've gone to the St. Louis Fed's FRED site, the economic research site, and I have found GDP. So GDP is going to be the final value of all goods and services produced in the economy in the given year. Real gross domestic product, real means that it was adjusted for inflation. Nominal would be in current year dollars. So this is real GDP. Anyway, so in 2019, GDP was at like 19 trillion. In 2014, GDP was, well, between like 16.5 and 17 trillion, depending specifically on the quarter, which tells us that this 1.1 trillion is approximately like 1/17 of the size of the US economy. Medicare is going to be providing medical care for the elderly, regardless of financial circumstances, and it's separated into several different parts. And so there is Part A, there's Part B, there's Part C, and Part D. Okay, so Medicare Part A is going to be automatic enrollment for those who have paid into Social Security for 10 years upon reaching their 65th birthday. Medicare Part A is going to be the hospital insurance, right? Medical hospital insurance. The structure is going to be, well, the patient pays the first day. Medicare pays days 2 through 60 without co-insurance. Then days 61 through 90 are covered, and up 91 through 150 if lifetime reserves are available for the patient. Beyond 150 days, then Medicare is not paying anything. Matter of fact, beyond 90 days, if the lifetime reserves are not available, then Medicare is not paying. So this 90 to 150 day, whatever is the limit, depending on the individual patient's lifetime reserve circumstances, does certainly expose the most vulnerable and the sickest to huge losses, right? Hospitalization is extremely expensive. Medicare Part B, medical insurance, this is physician services. So here there's a voluntary enrollment structure where patients have to elect to enter and then pay $160 annual deductible. Medicare Part B would pay 80% of the allowable fee set by Medicare, and then those with higher incomes would be responsible for more. Part C is Medicare Advantage, which has maybe 1/3 of those eligible for Medicare benefits having been enrolled in Medicare Advantage, which is going to pay hospital physicians drugs under a single plan. It's a private sector alternative. And then Medicare Part D is outpatient prescription drug insurance. One of the questions we want to reflect on, or collection of questions we want to reflect on, is who pays, who benefits, how's the system work? Well, who pays? It's a pay-as-you-go system, meaning that we're paying into Medicare over the working lifetime. As a matter of fact, something like 90% of the funds are paid in by those under age 65, which should be unsurprising because beyond age 65, people tend not to work as high as an intensity as they did earlier on. Who benefits? Well, it's great for the individual. We have this anecdote from Henderson, or this example from Henderson, from a couple who would be retiring in 1994, having paid in, let's just say at the average tax since 1966, would have paid a premium of $20,000, right, coming through payroll taxes, but would receive a benefit of something like $120,000 on average. So it's a tremendous deal for the patient. Medicare ends up paying something like 87% of inpatient hospital charges, 67% of physician services, but only 0.5% of long-term care. So there's substantial gaps in coverage, and even between some of these programs there is. And as you might expect, anytime that there's inefficiency in the system, there's going to be a supplemental market that can arise to try to, well, rectify some of those inefficiencies in one way or another. In terms of reform options, well, turns out Medicare was largely ignored by the Affordable Care Act. There are changes in Medicare tax, Medicare adjustments in benefits that related to things like preventive care and prescription drugs. So preventive care is a major focus of ACA. That said, the biggest effect was a cut of something like $740 billion from Medicare over the next decade, with the goal of redirecting these funds towards expanding Medicaid and then subsidizing the exchanges. So